Morning, everyone. Here we are again with this opportunity to share information to our constituents. Let me first of all express my appreciation to all of the first responders, our sheriff department, our hospital workers, our fire department, all of those persons who are responding to the call. Let me also express my appreciation to all of those cafeteria workers that are still preparing meals for our kids, the gas attendants that are there so that we can drive our cars. There are so many people stepping up and doing so many things to allow us to continue to function during this difficult time. I also want to acknowledge the incredible losses that we've suffered in our community. And not only losses relating to the COVID-19 virus, but just losses in general. I know, we know, that it's difficult enough to experience losses of our loved ones. But during this time, this abnormal period, when we are not able to do the traditional things that we do, that is to come and be around and comfort those who we care about. And, we always gather not because a person dies, but we gather because of the manner in which they lived. So I just want to pause and to say thank you to all of our funeral home directors and to those families who allow themselves to follow a disciplined pattern in order that we might be safe during this difficult period. And quite frankly, I look forward to the opportunity for us to have memorials where we do things in a more traditional way. And we get the opportunity to celebrate because you know what we do in these communities. We laugh together, we celebrate together, and in times of tragedy, we mourn together. I'm honored to be here today with Representative Cecil McKnight, Dr. Troy Gamble, and Dr. Rose Wilder. And each of us will come in our own way and try to share information and thoughts. Let me announce that we will have testing next week. On Monday, the 18th, there will be free testing over at King Street Senior High School. The times will be from 10 a.m. to 3 o'clock p.m. That's Monday, the 18th. The same will take place on Wednesday, the 20th, and also on Friday, the 22nd. And so we're asking all of those persons who feel the need to come and be tested, to come and be tested. I'd also like to express my appreciation to our supervisor and Mayor Tisdale, Mayor Parker, and all of the other mayors, Mayor Fulton, and those county council persons that are still trying to stay focused and deliver services during these difficult times. Dr. Wright and Congressman Clyburn's office is working also along with DHEC to bring testing to the Hemingway community. I apologize that we are not able to announce today exactly when that testing will take place. Dr. Wright has advised that DHEC has its telephone conference this morning, and we may know as early as this afternoon. But please be assured that as soon as we know, we will share that information with you in order that that persons will not have to travel as far. My understanding of how the testing will take place is that there will be a tent set up outside where persons can simply drive around and be tested. For those persons that are not driving, that are walking up, there will also be an opportunity for those persons to come up and be tested. And so please don't allow any circumstance to stand in the way of you and coming to be tested. If you need transportation or any of those kinds of things, please feel free to call my office, 355-5349. I'm certain that Representative McKnight will also give you all his number as well. because we are here to serve. And so I'm going to ask Representative Knight, if he doesn't mind, to come up now and make his comments.
Good morning, everyone, and most importantly, good morning to the citizens of District 101. I echo the sentiments that have been shared by Senator Sabb, and I am very hopeful and excited about the fact that we now have free testing available here in King Street. I don't want the citizens of the other areas, Hemingway, Lane, Salters, Trio, and people who live close to Andrews to feel slighted in that we will likely have testing in those areas shortly. It just so happens that King Street will be the place that is available first. It's important for those of you who want testing to get testing. Testing is probably the single most important way that we can deal with this pandemic. It allows for us to identify people, and it allows for us to follow back where they've been and further deal with the spread of the pandemic and the virus. So it's important that you participate in the testing as outlined by Senator Sabb. Next week will be an important week. There will be several businesses that will come back online pursuant to orders from the governor. It's important that you listen to information from the news, from the governor's office, so that you will know how to best govern yourselves. And most importantly, just because something is open, if you're uncomfortable, you don't necessarily have to go. You can continue to use your good judgment and your good common sense to protect yourselves and your families. So I advise everyone to listen to the words that come from our public health officials, and to do what they feel is best for themselves, and that is to continue with social distancing. Make certain that you wash your hands. It seems insignificant, but that is the single most greatest thing that you can do to prevent the spread of the pandemic, as I'm sure you will hear others tell you. And if you do need assistance in getting to the facilities, which Senator Sabb has outlined for testing, you can reach my office at 843-374-4529. We're on an abbreviated schedule at my office. We're there from 9 to 3 for the next few coming weeks. So thank you, and God bless you all. Be safe.
Thank you all. Thank you, Representative Knight. We're going to now ask Dr. Wilder if she would to come. I know that we've gotten a number of calls about graduation and how that will unfold, and Dr. Wilder has been kind enough to come with the idea of sharing that information at this time. Dr. Wilder.
Good morning, everyone. Senator Sabb, again, thank you for inviting me to be part of this press conference. I would like to share a few things before I go into graduation. Please know that we still deliver meals to our students. On Monday, students will get 2 meals. On Wednesday, students receive 3 meals. Parents, please know that the principals will be contacting you in reference to how to return your children's books to the school. We'll give you more details concerning that. Now to graduation. We have established a date for graduation and the times. We will have graduations at 3 sites. It will officially be on June 6th, 9 o'clock at Hemingway, 11 o'clock, King Street High School, 1 o'clock, C.D. Murray High School. And I have to share this with you. Please know that each student will receive 2 tickets. I repeat, each student will receive 2 tickets. The ceremony is not open to the public. We are still practicing social distancing. This is very important. The students have been informed. I actually had a conference with the senior officers from the 3 high schools. Students are aware of the procedures, and we're asking for the public support that you please adhere to the directives. We will have someone stationed at the entrance. And again, if you do not have a ticket, you cannot get into graduation. It is not open to the public. Each student will receive 2 tickets. If you have any questions, please feel free to contact me, 843-372-4862. Thank you.
Dr. Wilder, will it be streamed live or anything like that for other persons who want to?
Thank you, Senator Sabb. I appreciate you reminding me that. Yes, it will be streamed live, And we actually will have a videographer there, a professional videographer, to do the video for students, and they'd like to have one. You can also download their exercise from the district's webpage. Thank you.
Dr. Wilder, what website will stream the video of graduation?
I would have to get that from my community, okay?
Okay.
Maybe at this point, the question was what website, but we would definitely let you know, but right now, I know we're building the district website as well as my big websites, okay? Thank you.
Let me say before Dr. Gamble comes up, how much I appreciate the response of this community to the hospital's request. And Dr. Gamble will, I'm sure, talk about it a little bit more, but the opportunity was given to businesses, industry, and individuals to help the hospital. How do I best describe it? To help the hospital move from curtain doors to real doors. And I'm sure that Dr. Gamble will describe it in a more eloquent and precise way. But the beauty of it is we're able to transform it in such a way that the hospital is now able to deliver services. And that simply could not have taken place but for the teamwork that was exhibited by those businesses, those industries, and those individuals. And so delighted to present Dr. Gamble, who will not only talk about that, but bring us up to date on some of the other services that the hospital is now in position to deliver. Dr. Gamble.
Thank you, Senator Sabb. Thank you, Representative Knight, for allowing me to be here today. I can't tell you how proud I am to be a part of this community. When it became apparent that this was going to be quite a serious pandemic, one of the needs that we had in the hospital was to provide protective doors so that each ICU room could be more completely isolated so that we would not spread the virus. When we looked at the cost of that, it was prohibitive. Ms. Poston, our CEO, myself, and Fran Kleine, who's our Director of Marketing, each decided we would donate $3,000. Our foundation said they would put up money. And then we went to members of the community, and within 3 days we had enough money to buy, purchase, and place these doors for our intensive care unit so that we can provide care for some of the sicker people who have this COVID virus. And believe me, this is a very serious virus. It is running havoc on our elderly people in our community. We had 2 deaths over the weekend in our facility from the COVID virus. Luckily, we've had about 3 or 4 people during that same period of time that got well and went home. So we've made great strides to try to provide you the quality care that's available everywhere else in the country. We are still giving hydroxychloroquine and Zithromax along with zinc to most of our patients early on. It's still quite controversial as to whether this is effective or not. I personally believe it is based on my experience with treating this now for several weeks. It seems if you can get it on board early, and this has been confirmed by a relatively large study out of France. It was published several days ago by one of their leading immunologists, that it seems that if you can get these drugs on early, that many people do respond. Now, everybody doesn't respond. There's no panacea. There's no complete treatment or cure for this at the present time. We also have been lucky enough to partner with the Mayo Clinic so that we are going to be able to give the convalescent plasma you've been hearing so much about, where people who've had the disease, who've recovered, their body has made antibodies to attack the virus. And again, that's not a panacea, but many people are improving and recovering who get the convalescent plasma. So in partnering with the Mayo Clinic out of Rochester, New York, we're going to participate in their study to study the effectiveness of this with them, and we will have that available for our community, and we've already been approved to do that. So I think we've upgraded our facility. We are providing everything that anybody anywhere else is getting. We also, in the process of raising money, raised additional monies to buy additional ventilators. Our problem has been finding ventilators to buy. But right now we have 3, possibly 4 ventilators, and we're trying to buy 2 more. We have the money and the capability of doing that. The other good news is that because we are one of your largest employers in Williamsburg County, we applied for the CARES Act money. The efforts of Ms. Postman, Stel Hemingway, who is our financial consultant, and Douglas Broach, our CFO, we've been able to acquire the CARES funding to be able to fund our employees' salaries for the next 2.5 months, which is a big financial relief for an always strapped small rural hospital, so that we can continue to provide services for our community. It's important that we keep these beds open and that we keep our hospital functional, because we're running into times where McLeod and MUSC Florence and MUSC Charleston are full. And so it's good to have this facility and our own local capabilities to care for our own right here without people having to travel long distances, especially when family members can't be near their loved ones. We're trying to make sure that they're at least in close proximity to home. So those are the things your hospitals are doing for you. I applaud our representatives for our state for this allowing testing. We now have the rapid test available for our patients in our emergency room to know if they do have it or don't have it. We have those tests back in 20 minutes. That's the Abbott test you've been hearing so much about on in the news media. We also have the test that goes out to DHEC that confirms that rapid test when needed. What we're finding is the rapid test is very accurate and seems to be correlating very well with the send-out test that takes 2 days to return. So we have all the testing modalities needed for our acute care facility and our critical access facility, and we're trying to provide you and your community everything that you can get elsewhere. Thank you.
Thank you, Dr. Gellman. Michelle, anybody, any questions? Well, thank you all so much. Please continue to be safe. We are not out of the woods, obviously. And let me just reiterate in closing one of the things that Representative Knight said, and that is we don't have a one-size-fits-all kind of situation. And so just because it might work for one barber, it may not work for another, because that barber might have a pre-existing condition which makes him or her susceptible to the virus. And so we're just asking everyone to please just continue to exercise prudent judgment and good caution. Thank you, and may God bless.